we're going to speak a little bit about a part of rehab that's much less understood, and that is the general rehab category. Everybody understands that in a rehab hospital, we take care of strokes, spinal cord injury, multiple traumas, brain injury, and categories that are largely neurological. But we do have other patients that have needs that are purely rehab. The difficulty is defining those needs and then making that work with our new system of funding from the federal government. As a part of the requirement for rehab, we have to have 60% of our patients in the more common, well-known diagnoses, notwithstanding the need of other patients that have very real rehab needs. They either can't walk, or they can't dress, or they can't even get up from a chair. That particular population of patients has needs, but they don't necessarily have funding or the blessing of the federal government and other insurance companies. So as we look at those people, we have to look very carefully. We do get referrals. If we get a patient that's in horrifying congestive heart failure, for example, and they can't really move hardly at all, they become short of breath in 5 feet, we probably will not help them. So they will not be included, even though that's a good diagnosis. As much as it seems like cardiac diagnoses should be part of rehab, they are not in terms of the 60% qualifications. So when I get a referral on what we call a general patient, it's typically cardiac, as I said, but it can be pulmonary. It can also be a minor injury. When I say minor, it's not multiple broken bones, but 1 or 2, and we'll look and see what that does. Probably a good example is somebody that has an upper extremity fracture normally wouldn't need us, but if they're 85 years old, they have an upper extremity fracture, and they have to use a standard walker at home, which requires both upper extremities, they have a very real problem. So we'll admit people like that. The other category is the typical medical debility patient. Many people have either a surgical procedure or some type of medical problem that's very, very complicated, very prolonged, and they can't walk, they can't hardly get up. They don't qualify in terms of the 60%, but they certainly qualify in terms of the need. That population, if they're down, if you look at the studies, typically loses 3% or more of their strength a day just by being down. And if you superimpose whatever their issue is, whether it's cardiac or pulmonary or surgery on the abdomen or surgery on the chest, they have very real rehab needs, and that would be another population we include. Our referral sources are sometimes confused by our response, because even though somebody has a specific need, because they don't meet federal government criteria or insurance criteria, there's a funding issue, and we'll go to bat for them. But if they aren't going to be funded by their company, then we have a very real problem. So when we get off in that category, it's always going to be the same thing. Do they have rehabilitation needs primarily, and we go to bat for them? But if they say no, that's it. So as we define this population, we have to prepare our patients, our family members, and our referral sources for possible turndowns based on things that we don't have any control over, and frankly, things we don't really agree with.